cognitive behavioral therapy through a trauma-informed lens and solution-focused therapy and family systems approach. She has a private practice and nonprofit organization located right here in Fullerton. And then representing Wound Walk, we have Dr. Mahnaz Pezeshpour, sorry. She's a psychiatrist, is a child and adolescent and adult psychiatrist practicing at Kaiser, Orange County since 2009. She provides she provides medication evaluation visits for children, adolescent, and adults with psychiatric conditions such as depression, anxiety, ADHD, schizophrenia, and substance use disorders. In addition, she is a faculty member at a family medicine residency program supervising residents, physicians in training, rotating at Listonac Free Clinic, and of course, she is a volunteer with Wound Walk.
People with ADHD don't need medication. Make some words.
We'll definitely go over a lot. We'll definitely go over some of that as well. And then we have also representing Wound Walk, Dr. Kunchai Mias. Please come on. He's a board-certified family medicine physician and currently a community medicine fellow for Kaiser Permanente, Orange County. He's been working with Wound Walk for 2 years, providing medical care to the population as well as acting as medical advisor to the organization. He finished his residency at UCI with primary care specialty and is finishing fellowship this June in community medicine subspecialty. His mission was to start street medicine. He is very valuable physician in the Wound Walk community and has invited other physicians and residents to join on a regular basis to further the work they do. Thank you very much, all of you, for being here. And now I'd like to invite Ms. Liana to come up and join me as we moderate this panel.
All right, so we do have some questions for all of you. Again, thank you so much for being here, individually for each organization and panelists. But just to start off, I would love to just pose one question to all of you that we can answer one at a time. In just a few words, what do you see as the largest hurdle in the mental health space right now for members of the community? For example, is it access to resources, willingness to access those resources, the stigma around mental health, or just not knowing where to get started? So if we want to just start on our far end and one at a time.
Is it? Oh, it's okay. I don't know if there's a simple, just a few words answer to that question, but I do think that it starts a lot with not knowing where to start. A lot of people don't know where to start, and then once they figure out where to start, sometimes there's a lot of hurdles with how long it takes and waiting periods and costs. So there's a lot of barriers to it as well. And I think that's really where the biggest challenge is for right now.
Thank you for that question. I think what are the largest hurdles? You saw in the documentary, really, it's a bit of everything that you listed here. Willingness to access to resources, not knowing where to start, and the stigma. I really have to say that the stigma of mental health or mental illness really could possibly be the largest, the biggest barrier, because I think it starts with the self. We impose self-stigma. We feel shamed. We have the sense of not feeling that we're enough to even acknowledge that we might be struggling with something, not knowing that we're struggling with something, right? And so knowing what the signs are. And I think that's where it all starts, and it starts in the family. As a young kid, family, not being accepted, maybe being brushed off as, well, it's gonna go away, like we heard with Helen's story. Actually, with all the different stories, they were so powerful because they addressed each of these issues and really not knowing where to start. So we'll hear more about that part later, and I'll let people.
Testing. Okay, it is working. I was gonna say the same thing. I think all of those are barriers to accessing mental health treatment. The stigma probably is the biggest piece, and I think the earlier that we start talking about it and in ways that are tangible and understandable and don't involve shame, is that shame piece really, and potentially feeling broken. None of us as human beings feel good when we think of that. And so it can be challenging to share that with other people and finding people to even trust to share and be vulnerable with. Accessibility, that's been a big one throughout. We started the nonprofit in 2020, and lots of times when we're returning the phone calls, the people are thanking us for returning the phone calls and saying that they've called like 20 to 30 providers and no one's returning their calls. And so the mental health, we're really swamped. There's a lot going on, and being able to provide access to those services has been a barrier that we're fighting to break.
Thank you. So I was thinking about, as I was listening to others, how to approach this question. I actually think that we are, as a society and community, we are a little bit doing better as far as addressing the stigma after pandemic happened. People are more reaching out to others, and they have more variety of resources, podcasts, nonprofit organizations. There is much more awareness, I would say, about mental illness now compared to prior to pandemics. Of course, we are not there where we all hope and want to be, but I can tell about my recent experience about joining the Wound Walk, and I see now a more, I would say maybe the most vulnerable population in our community that deal with the stigma, and the stigma is a major barrier for them, even when there is access to care. So hoping that each of us can be a voice for others.
It's just a little bit hard to hear towards the back, so maybe the microphone's a little closer or a little louder.
Yes, and I was gonna say that if you can just hold the microphone a little closer. And also we have an audience online, so the louder you can speak and project, we'd appreciate that.
How's this? Good? It'll be the first time that somebody says that I'm too quiet. Going last is always a little difficult, just because I want to echo what everybody else has been saying. It starts with stigma. With stigma comes a delay in self-recognition that there is a problem. Often I'm in a unique position as a primary care doctor that we will see people at their worst in other situations. And as a physician, we recognize, and we keep saying it, we'll write it in our notes, but the person who is living it cannot acknowledge it or does not want to acknowledge it. Then you have a delay in access, then you have a delay in, or a restriction in resources. And this all just goes on and on and on, and really delays care. And as a physician, delays in care cause chronic issues. And in mental health, these chronic issues just become devastating. I'd like to thank everybody here on this panel, as well as many people out there who are trying to increase access, who are trying to increase the resources. But yes, stigma has been a major, major issue. So I do agree with my colleagues out here as well.
It seems like we have a really unified theme here of stigma, right? That is one of the main words that came from this panel. I want to do just a follow-up here on stigma. Somebody noticed earlier that most of the attendees here are women, and maybe that's changed a little bit as the audience Amen. But is there any kind of stigma? I mean, obviously it's a big word, but are there any gender, I guess, reasons for stigma? Do you see this more in men or in also any cultural?
In generation.
So myself and Dr. Pezich-Bohr, outside of doing Moonwalk, we also have a behavioral health clinic twice a week at the Free Clinic. And I'd actually been there just a couple of months before, and I was trying to figure out why all of our patients were women. Most of our patients were Spanish speaking. They were all women, depression, anxiety. The few men we got were because some family member had brought them in due to a usually a psychotic disorder where the person couldn't take care of themselves, physically couldn't feed themselves, clothe themselves. So there is some forms of stigma culturally, at least within the community we serve at the Free Clinic. But also there tends to be, from a physician standpoint as well, when it comes to diagnosis, stigmas within healthcare workers as well. Psychotic disorders tend to get caught more with male or cis males, and then depression, anxiety, we tend to see more or diagnose more women, although these are not exclusive. This is just talking about people who follow cisgender roles, not even talking about everybody else that falls on the spectrum, which is a whole nother topic. I leave to others to share their experience.
Yeah, so I really appreciate that question. I think one size doesn't fit all, right? We see in our work at the agency that we have populations, for example, men, right? Men with the masculinity, the idea that they're raised to be strong individuals. They're the caregivers of the family. Mental illness in cultures is seen as a weakness. And so if anyone who is struggling with some kind of mental illness symptoms, if especially you're male, you're not going to acknowledge that. We actually see a lot of vets. We work with a lot of vets in our services, and they have gone undiagnosed for years, especially with PTSD, many of them for decades. We have many great programs, and we find that after they have been through some of these programs, they actually break down and acknowledge. So I think for men, the masculinity, now for women too, they're traditionally seen as the caregivers. From Helen's story, it seemed like you were the caregiver for, you said parenting roles, you had to assume parenting roles. And I think sometimes women adopt these very natural gender roles. And so being that they are caregivers, they put themselves last. Whether it's a mom, whether it's, we might be professionals. We saw that during the COVID era, many of the nurses, they were also struggling with their own mental health, with isolation, with physical illness, and yet they put themselves last. So I think if you really think about it, there are definitely very gendered identities, and they interfere and really play a role in stigmatizing themselves, as well as there's many also cultural factors that come in. I could go on and on, but I would like to give others an opportunity as well.
Yeah, if I could just add to the cultural part also, you mentioned a little bit, but in the school district that I work in, we have primarily Hispanic Latino families. And there's always been a stigma between Latino men and women and mental illness. And men, it's very common in Latino culture, the machismo, you work, you provide for your family, you work hard, you pay for everything, your wife stays home, takes care of the kids, and men can't be exhausted. They still have to go to work and provide every day. They can't show emotion. When they raise their kids, it's a lot of, don't cry, stop crying, why are you crying? Why are you crying? you know? So there's a lot of cultural stigma, not just with Latino, Hispanic cultures, but also within Asian and Pacific Islander cultures. I mean, it's across the board. Every culture has a different kind of stigma when it comes to those gender roles and who are the ones that are struggling with mental health and who is more likely to acknowledge it and to seek the support.
Thank you, everybody, for that. I really appreciate it. So next we're gonna go from agency to agency, and we're gonna go ahead and start with our hosts, Villages. I'm sorry, I just got you there. We're gonna, for your questions, kind of focus on the youth dealing with mental health, and I'm gonna just ask a couple different things. You can pick what you feel like is best for you to focus on and how you wanna answer this. But we're just curious on, from your point of view, what is the impact you're seeing of mental health on our youth? And what particular struggles are they grappling with? How can we ensure that the young people in our community are taking care of their mental health and getting access to resources? And if they're hesitant to talk about their mental health, what can we do together? And what is your team doing to help support this?
Okay. Wow.
That was a lot. I know.
Let me start with the original. What is the biggest struggle?
What is the biggest impact of mental health on our youth, and what do you see them struggling with the most?
And if you could put the microphone as close as possible.
Yeah.
Not like
Same.
screaming at anybody's. Okay. So the biggest struggle that I see with my kids, and I work with elementary age students, so as young as 3, 4, so TK, all the way up to 11, 12, 6th grade. And it's kind of a cycle, but a lot of struggles that they have are family stress. So a lot of my clients and students that I work with are experiencing family stress, kind of like in the video, Juanita and her 2 sons. That's actually a family at my school site, and those are kids that I work with. So these families are struggling with homelessness, low SES, job loss, blended families, divorce, domestic violence situations, and I could go on. But in the school setting, the other thing too is that, these kids' parents are becoming younger and younger. So parents are also still growing up while raising children. So in the school setting, what this displays as is a lot of my students and clients are experiencing challenges with managing their peer conflicts, peer relationships in general, a lot of emotional dysregulation, which leads to behavioral challenges, and then all of this kind of combined causes the mental health challenges with anxiety, again, emotional dysregulation, and really they are struggling to identify and use positive coping strategies or coping skills. And they've really never had somebody to show them or teach them what a healthy coping skill looks like or what it could be for them. Another influence that my older kids, especially 5th and 6th grade, before they're transitioning into middle school, that they're experiencing is an overexposure to social media and technology. These kids are just growing up in a completely different generation than when I even grew up. And like many of us in this room, it's totally different from when you were a kid and when you were a preteen. So it impacts a huge part of their lives. And then it causes them to idolize these unrealistic things and compete with one another for clout, as the kids say. And then the cycle just begins, leading back to their peer conflicts, and then their parents not knowing how to help their kids navigate, not knowing what exactly to teach them or what to talk to them about. And then the kids are just managing all of these things combined, along with the stress of their family and having to come to school every day and be expected to listen and focus and learn. And so I think the second part of the question was, how are we ensuring that our young people and our community are taking care of their mental health and how we're giving them access to these services. And honestly, the whole reason that I was so excited to work at Villages of California and with the team that we have there is because our mission is exactly this. to bring awareness about the importance of mental health, and to normalize it, to make access easier for students, families, and whoever within their community. So I work primarily with the school-based program, and that was one of Village's first and largest programs. We of course have others that are continuing to grow and expand all the time. But I'm with the elementary age students, so I'm at the school all day, every day, not just as their school therapist, but I'm running social skills groups. I do classroom guidance lessons. I'm working with my counseling team, and we do a bunch of fun reinforcement activities, but all of this stuff is surrounding social emotional learning and mental health. And then at the same time, this year I've gotten a lot more opportunity to engage with parents and families. So I run a mother's group after school. I do family sessions after school. I'm accessible to these families after their work hours. So it's not just the kids during the school day, it's after school, because these kids, some of my kids are in school literally 12 hours a day. They come in the before school program at 6:30 in the morning, and they stay after school until 6 p.m. Their families work, just like a lot of these families and individuals in the video. I mean, everybody has to work and make a living, and their kids have to stay in school. So, sorry, getting off track, but I'm available to all students at the school site, not just the ones on my caseload. And that's the whole purpose of our school-based program, is to have a clinician at each school site within the district. And the younger kids, they are exposed to taking care of their mental health on a daily basis. They have it at school, which is where they spend the majority of their time. So it helps them, it helps us clinicians connect with their families and the adults in their lives. And it also allows us to share information and connect to the individuals to all kinds of community resources. And most of them never even knew that most of these resources existed. They come to school and we give them information and we hand out flyers and give them phone numbers, and they're like, oh my God, this is right down the street. I didn't even know this was ever there. And that's the point. These are free to them, easily accessible, and they can get all this stuff at school. The kids are excited about it, so they go home and they talk about it with their families and their parents. And this is how we're combating that hesitancy and the stigma, by just making it an everyday part of life for these kids. And starting younger and younger makes it easier, I think. And I do know that with my students, I feel like there's less of a stigma because they are so exposed to mental health. TikTok and Instagram, as negative as it can be sometimes, can also be positive, because they see these videos and they're exposed to what mental health and what healthy coping can look like.
Thank you, Amanda. I do have a follow-up question for you. With youth, LGBTQ youth have a higher rate of depression and suicide than others. How do you address that, and what advice do you have for parents who have LGBTQ plus kids?
Yeah, it's tough. Because in the age group that I work in, some of these kids are trying to figure out their identity, whether it's a gender identity, whether it's just a sexual identity, or just whether it's who they are, no matter what. And some parents and families are not accepting of that because it's just not talked about. Again, it goes back to a cultural stigma too. So at school, we try to promote, like, you are free to be whoever you are, whatever you want to be today. It doesn't have to be the same tomorrow. You have a safe space always in the counseling room or with our team, and at school, we're there to keep you safe. And we really try to help those students in particular process, and really just giving them a space to be heard and to feel validated and to feel comfortable in their skin and know that, like, it's confidential most of the time, unless, there's a safety concern. But it's really just providing the space and the ability to explore, whether they get it at home or not.
And any advice for the parents?
Listen to your kids. It's a huge part of attachment and bonding with them, is also listening to their interests, their curiosities, their concerns. I think that's the best place to start as a parent is to just listen, and as much as you can, try to, I don't wanna say conceal your thoughts and feelings, but just listen at first before revealing the rest, especially if you don't understand just yet.
And I know this is a very big topic and we can have a whole symposium on this, but I do want to touch on a few things. The youth is a very important aspect of this discussion. I want to follow up with two things. One for you, Amanda, and one actually for you in dealing with access especially in group therapy and so on. How, first of all, if you can touch on bullying in schools, because that has an impact as well. And now we have also cyberbullying. Anything on that you can share with us?
Yeah, it's just never gonna go away. That's the bottom line, you know, bullying and cyberbullying, and especially with the way that technology advances and the way that these kids advance with learning it and knowing how to navigate it, it's just always going to be there. So this is where we teach kids how to manage their relationships, how to manage the conflicts, how to cope, and de-stress and try to focus on what is actually important. And then for parents, it's really, again, monitoring your kids, but being aware of what their interests are, where they're going for their entertainment, what they're doing, who they're talking to, you know, because it's things like Fortnite and Roblox, and I don't even know any of the other games, but it's all of that stuff that parents are just like, oh yeah, he's on his Xbox playing Fortnite. Well, no, he's not just there playing Fortnite. There's a whole chat and things that are going on with other students in their school, students that they don't go to school with, adults that they might be playing with. So monitoring that stuff and just being aware. You might put the parental controls, but these kids will figure out how to go around it. Yeah, so for parents to combat the bullying is really just paying attention and spending that quality time with your kids to be interested in what they're interested in.
I do have one follow-up for you, Nicole, but I think you're next anyway. So I will say what I'm going to say, and then I'll give the main question back to Liana. But how do you help parents and kids through counseling in your expertise, manage all of this? And you know, again, it's not one thing, it could be multiple things at the same time even. And then once we get to some of our other panelists, I do want to ask also about therapy versus drug intervention, right? So, or medicines.
Like where do I start? Oh, wait,
We'll go Liana first and then we can get back.
So for High Hopes Counseling, oftentimes mental health can be improved through counseling, but members of our community can't always afford such services. How is High Hopes making counseling accessible? And how are we filling the gaps that insurance doesn't cover?
Shall I start with your question first?
However you want, you can tie them all in together.
Okay, all right, okay. All right, I'll try to go in order. How we work with the parents and the kids and to be able to talk about these pieces, it really comes down to us feeling safe as humans, right? And the kiddos feeling safe enough to share with their parents. And so that really comes down to parents knowing themselves and knowing how to regulate their own emotions when they may potentially start to get triggered by anything their kiddos may be sharing, and being able to hold that safe space so the kids do feel safe to talk to parents, especially about the bullying pieces. I think that's a lot of what leads to suicide in our kiddos, especially nowadays, of just that constant pressure from, that just really doesn't shut off, going 24 hours a day. So, having that open communication, teaching the parents first, teaching the kiddos, and creating a space and also modeling it for them. We role play with the kiddos in session. We also role play with the parents, being able to teach how to have conversations that our nervous system or brain may be teaching us is difficult and that we may want to try to avoid, but that it's important to lean in even when we're feeling uncomfortable. And teaching that at a young age potentially will help reduce experiences or more adverse experiences as we get older. All right, how High Hopes Counseling makes services accessible. One of the ways that we do that is offering reduced fee sliding scale services. We don't accept insurance. We have actually found that that is a barrier for some of our clients. When people are calling in, they've been waiting with their insurance companies for 3, 6, sometimes 9 months. So by being able to offer a reduced fee, it opens up the accessibility. Let's see, what else? The ways we fill the gaps. All right, ways that we fill the gaps. So other than having the reduced fee services, if the clients are not able to pay, we do adjust those fees accordingly. If they're unable to pay for a session, we also allow them to have some pro bono sessions and work with them in that way. We train graduate students and pre-licensed clinicians to be able to provide those services, and then I supervise them. So they, it's kind of like having 2 therapists on the same caseload, and we kind of all learn together. And we're able to do that, and that's what we're able to provide those reduced fees. Adjusting the rates. We also screen all of our clients that are coming in. We provide ACE screenings for. That's the Adverse Childhood Experience screenings, and that really gives our clinicians an opportunity to see firsthand as the clients are coming in the door how much trauma they really have experienced within those first 18 years of their life. And then that allows us to be able to know what direction to go in for treatment, whether anxiety or depression or some more complex PTSD that a lot of our clients tend to be coming through the door with. Let's see, our screening. Oh, we also provide free group counseling. So that's one of the things that we've done since we've opened, is making sure that even if clients are unable to provide or pay for individual counseling, that they still have access to services and a place to be heard and a safe space to come to. Let's see. Oh, we also do work in the community with the youth, with the Boys and Girls Club. So we've been providing free services to them after school, and we teach a special program that teaches behavior regulation and them learning all about the feelings and stuff. One of the ways we also teach therapy or learn about oneself is we try to make it really tangible and try to remove the stigma that way. So for instance, one of the things we use to teach is we have a picture of a battery, and we use it as like a cell phone battery. And then we use that when it's like fully charged and we're in the green zone. That means we're in a safe zone and we can function and do the things that we need to show up to do for the day. And then as our battery depletes and we move more into the red zone, then that's kind of like our window of tolerance reducing, and we have less patience. Sometimes we're more, become more frustrated and such. And so we try to teach them, the kiddos and the adults, hey, this is what it looks like, and each of us are different. So what does yours look like? What are the tools that you need to be able to regulate, to show up, to feel better for yourself, and to function in the world around you?
All right, we're gonna move on. Thank you so much, that was amazing. Kind of falling back on where High Hopes is filling the gaps with their affordable services and free services, which we appreciate you bringing to our community so very much. I would like to pose this question to Dr. Rao from the Orange County Health Care Agency. As a government entity, what resources does the healthcare agency provide for mental health services? What is happening on the local and county level to positively impact the community in regards to mental health?
Yeah, so I think continuing what Nicole had said, for the Orange County Healthcare Agency, our services to our clients are at no cost. So that's one thing that I would like for everybody here to know. We have a full continuum
Doctor,
of,
can you hold it up?
sorry.
Yeah, I know it seems like so close, but you have to talk that
Well,
close.
we have therapists who are,
Everything you're
who are
saying
very
is so
quiet and
important,
calm.
so we want everybody to hear what you're saying. It's free, say it loud.
Yes, our services are at no cost to individuals who come to our doors. So that's the first big thing. We have a full continuum of services. We have, starting from mental health wellness services. For example, this event is one of those that we actually sponsor. So that's for mental health wellness and stigma reduction. We have services for prevention of mental illness. We have services for early intervention, treatment services. We have crisis services. And then we also have suicide prevention and postvention services, the full continuum of services. What we do is we take our services to the homes of individuals. They're field-based. So we go to their homes, in the schools, in the communities, hospitals, wherever our people live, we take our services to them. The other thing is that our services are, we are also a payer of last resort, really, because it's a safety net. So the healthcare agency is a safety net. So we welcome everyone. There is an open door policy and no barriers really to care once you get there. Actually, what I wanted to say is I know we have so many services, but in the back, Jennifer on the table has this very important resource. If there's one thing you remember from what I said, remember we have the OC Navigator. This is a phenomenal navigational tool. We have a QR code on the back. We have this card printed in all languages that you can remember that are spoken in Orange County. And we have 24/7 navigational coordinators who are available to you. You just actually call the OC Links line. It's all in this. You don't have to remember anything. So the OC Links navigators will answer their mental health specialists and counselors, and they can give you resources not only for mental health, but also other support services, housing assistance, food assistance, services for transportation needs, 24/7 crisis support, of course, medical assistance, and also services for domestic violence, among others. Every support service that you can think you might need, first call the healthcare agency OC Links line. In addition, I also want to say that we have, for mental health, we have a 24/7 warm line service, and it is confidential. It's actually anonymous, so you call in. There are 24/7 counselors available on the other side in multiple languages, and they're there to provide emotional support. We have repeat callers, and in fact, we encourage repeat callers because we know how much loneliness there is in the world, especially for youth. They feel very disconnected from their families, from even their peers sometimes. And we have a large number of youth actually calling our warm line because it is very confidential. You can be actually texting somebody on your phone. Sometimes parents get very critical. Why are you on the phone all the time, right? But we don't know if we don't listen to them, right? They might be actually on the phone reaching out. So this is another very important resource. And I know you asked, the second part of the question was, what is happening at the local and county level to positively impact the community? I'm so proud to say that our healthcare agency provides many resources to have a real impact on mental health in the community. So for example, we have many wellness services that we support and fund. Everything costs money, and so once we have those resources, we are able to fund and support programs such as this one. In addition, we have programs for youth. We have programs for all age groups, quite frankly. All of these services are to promote mental health awareness educating our community, reducing stigma, and really addressing the barriers to access care. What we do is we like to promote help-seeking behaviors. Every program that we put in place, of course, they have to comply with, they have to be providing mental health awareness, education. We have a lot of outreach that we're doing in the community. You might have seen Jennifer and her colleagues out there at the schools, at the hospitals, in community centers. We're doing outreach, promoting mental health awareness, wearing lime green, and having conversations with just regular folk. I know the Villages of California goes out to the Northgate markets, for example. Again, that is a program that we support. Now you ask, well, what are they doing there? Well, they're engaging the community. Somebody shows a little curiosity, you hook them, and then you talk to them and ask them, how's your day going? And sometimes that might be the only hook that you may have had all day. So it's these kinds of programs that we really put our resources and provide a lot of support out there. Many different kinds of programs are out there, not just outreach. We support programs such as art therapy. Actually, today we had a phenomenal art therapist who was capturing just conversations in the room around mental health. And what she does is she goes out in the community and she provides art therapeutic lessons. So you may not be an artist, but then she will teach you how to translate your emotions, your feelings through art, just like Helen did through her poetry, right? So we have the spoken word, we have art, we have play, we have storytelling. And what we do is we go out to the community. So we've been going out to the Boys and Girls Club, we've been going out to Orangewood, we've been going out senior centers, actually even at the workplace with construction workers, with our veterans. And every time we go out there, when we do art therapy, it's amazing to see how people really embrace and accept that, because there's no judgment. It's a very safe zone. You're able to express your feelings and emotions. And we find that the most success with this project has happened with our seniors, especially seniors from diverse communities, refugees, immigrants. I don't know if you are aware, we have a very large refugee population right now in Orange County coming from Afghanistan and Syria. And we've housed them in Orange County, right in our backyards. But it's not just enough to give them housing and say, now you're on your own. So we're doing a lot of mental health supports through these programs. And when people find a little time and they actually take advantage, they find that if their mental health is good, then they're able to be much more resilient and be present with their kids, at work, et cetera, et cetera.
Yes, thank you so much, Doctor. We appreciate all of that. We appreciate everything that the Orange County Healthcare Agency is doing to support mental health awareness and support. Okay, for our last group of questions is for Moonwalk. Moonwalk, we would love your insight on the link between homelessness and mental health. I know this is a huge topic. So I'm gonna just turn it over to your expertise and what you think is best to communicate to our audience today on this subject.
So are the filmmakers and creators of the documentary here, actually, still here? No? No? Oh, yeah, back there. No, I applaud you because you actually made my job much easier. So the story that Juanita shared sums up better than anything you can say. So a big misconception is that those experiencing homelessness inherently have a psychiatric disorder. That is not true. In her situation, she was a great example of how outside circumstance, this one just so happened to be related to mental health, but it could have been anything, like, oh, I don't know, a 2020 pandemic, or a loss of job, or an internet bubble in the 90s, right, can cause somebody to experience homelessness, and that stressor then perpetuates, feelings of self-doubt, feelings of depression, anxiety, food insecurity, and that perpetuates mental health. On the flip side, we all have seen individuals who have experienced some form of mental disease, who cannot organize themselves, who cannot fill out paperwork, who don't want to work, just like Jin, right? Who was experiencing a lot of stress and had issues at work, which caused, many issues with keeping the job. So it's an interesting question because it is highly complex. It's not a one-to-one ratio. They are two separate entities. To say that they do not touch each other would also be ignorant to the fact that yes, they are heavily connected. I'll leave it at that because the stories there, again, show more than anything it can say. When it comes to what we do as physicians and medication and the need of it within the community, I'll leave that to Dr. Pesishmore.
Thank you. Can you hear me better now?
Yes.
Thank you. So, what I have learned from showing up with the own walk street medicine is to meet people where they are. Sometimes they're already, they have had, let's say, hospitalizations in the past or treatment in the past, they're very familiar, and that's where we can help them, whether it's for substance use, detox, or if they're intoxicated at that point, they're going through withdrawal symptoms. That's a different phase, but there could be individuals who is their first time even can trust and be open to speak with someone. For example, we had one of the female patients who, for a variety of reasons, which does not make sense, has been sent out from the shelter, and one of our team members, Kat, has been really advocating for her to find a placement. She has been able to take the medication, but the place she lives, they did not give her the medication for a week, and we are back to square one again. So what I'm trying to explain from this example is, it is developing the trust with the individual, finding out where they are, where they meet them, having them to trust the clinicians and other people who are in the group. We have undergraduate students, medical students, residents, nurse practitioners. We have a variety of people who are educated and willing to donate their time and come to the community and help the group. So medication is part of it, that we do the evaluation. Yes, there is a room to prescribe the medicine. And for the second part of it, is not just prescribing medication once. You definitely want to make sure that we can see them for follow-ups to find out whether we are in the right path for the treatment, and along with medications, what other things as far as therapy, vocational skills, and other social skills and other things that are necessary are going to be offered. So I'm going to ask each and every of you to please spread the word. Go to our Moonwalk, Instagram, Facebook, look at those videos, and as much as possible support and donate your time or your voice, which you really can. Thank you.
And because we have very young people working, we also have a TikTok, and there are dances there.
For that. I know we are running a little over, but I did want to get at least a couple of questions from the audience. So forgive us if your question isn't asked or answered, but there'll be opportunities to connect with any of our panelists and the organizations available. So please do connect with them and ask those questions in depth. But one question that I thought was very relevant, I think. What are the impacts on that mental health could have on our physical body? A lot of people who suffer also manifest physical illnesses as well. Could you maybe, anybody on the panel?
I mean, the doctors are gonna know best, but this was a personal thing for me, because when I was in grad school, learning about it. We found a therapist and about talk therapy. I never really understood the body work that we would learn about and speakers that would come into classes and talk about, and I didn't get it until finally it was like, I have some question like, what do you, when you are worried about something or when you're nervous, like what does it feel like in your body? Where in your body do you feel it? And I was like, I don't know, just in my mind, like there's a million things going through my mind. But then I started to pay attention to my body. And so for like anxiety, a lot of people, for me, it's like my chest gets tight. Not like heart attack tight, but like I forget to breathe for a second. Your jaw clenches. Those are some physical symptoms of anxiety. And that's a lot of what I also teach my clients and students at school is to learn how to identify their body triggers along with their mind and emotional triggers. But mental health can impact your physical body in so many different ways, and it's different for every single person. But that was my own personal experience with it.
And Dr. Mahnaz, would you like to
Sure.
say this?
Okay. So I think just imagine that our body, from different parts of our body, from brain to our vision, hearing, heart, lung, stomach, every part of our body, if you imagine, when the stress comes, whether in form of anxiety, whether in form of depression, or other mental health issues, it can affect each part of this. For example, you mentioned some of the anxiety-related symptoms. People can even develop chronic pains. People can have difficulty focusing, concentration, balance of the body can change, movement disorders. So forgetfulness, you can name many. So I think the important part is to pay attention when we are going through stressors. Pay attention to what our body is telling us, what is a change, and then communicate that with clinicians and hopefully can address those.
I have also one more question. An individual who has called for referrals, got a long list of organizations, but they were not taking clients. And it took 4 months before they were able to access and have some sort of clinic take them in. And this is probably for both Dr. Rao and High Hopes. Maybe you can briefly address this issue.
I think that definitely is something that we saw post-pandemic. I think that it's still happening when our phone is being answered. They say that they leave numerous messages and people are not getting back to them. And most times this barrier to care is connected with some of the insurance companies and whether or not, the mental health providers really have not had a break since the pandemic either. A lot of the professionals in the medical field. And so there's also a lack of providers, I think, to meet all of the needs that are out there. And so that is usually what's happening in that time period. When we have clients show up at High Health, they're like, oh my gosh, we're so grateful, like, just thank you for returning our call and being able to come in. And that really feels good to be able to at least have that space and accessibility, even if they're waiting until they are able to connect with their insurance and get onto a provider's caseload.
Can I speak on something with that? Just my own personal experience. My child, they are on Medi-Cal. It has taken them 6 months to see a therapist. Sometimes you just have to stay diligent and you just have to nag and nag and nag and use NAMI is a great resource for support groups. I highly recommend NAMI, the National Association for Mental Illness. They have amazing workshops, programs, support groups that are free. You just have to be your own advocate or find somebody that, if you're too low or too stressed or too much anxiety, have somebody help you be that advocate. But it's not easy. It is not, even when you have insurance, it's not easy. You just have to find a plethora of resources and find your bag of tricks. And you have to do it on your own, unfortunately, but find somebody to help you through it.
Well, you stole part of my thunder there.
Sorry.
No, I'm so glad that you actually put NAMI out there, because NAMI is one of those programs that we actually at the healthcare agency support. And the warm line, the 24/7 warm line is funded through the healthcare agency. And it truly is a great resource. We sometimes do mystery shopping, and believe me, they actually pick up the phone, answer in multiple languages that you might need some support and help. And not only that emotional support through the telephone or chat, but also, like you mentioned, all of the variety of support groups for parents, for family members, and a whole host of different kinds of, they have separate groups just for youth alone. And it is a support service. As far as therapeutic services go, for Orange County Healthcare Agency, we serve those, especially treatment, folks who don't have insurance. And I have to say that our wait list isn't as big as what we see sometimes with the insurance providers. I know I've struggled with my own private, insurance, the HMOs. Just getting a doctor's appointment is hard, and I think you're right. I think the honest truth, the straight talk, is that we can do is that there is a shortage of therapists, and we as the healthcare agency are also facing that, especially in language. So like you said, keep persisting. But honestly, if there is that one place that you could call, is the OC navigator, and at least they might help you navigate through and find you some kind of assistance. At least that's the hope that we can provide you.
Well, I do want to end with something about stigma. Stigma is, I think, the main theme here. This has been really about talking about the issue. Sometimes we can't fix the issue unless we start talking about it. So this is what I believe in. I sometimes, I'm in local government, and sometimes I know that I can't necessarily address all the issues and fix all the issues, but I know I can certainly talk about them. Because unless we spotlight the issues that we have in our society and start talking about those, we can't start grabbing onto the thread that ultimately leads us to solving these issues that we have. I'm gonna hog the mic for a tiny second here, because there is something that I'd like to share. In the city here at Fullerton, there was a question here, it was more of a comment about why do we use dog therapy, dogs for therapy. And our police are actually, do have a cute dog called Nubbin. I want to plug Nubbin. The dog she is a therapy dog. She's a community dog, an officer actually, she's an officer. And she goes out to situations where, whether it's a school or even in critical incidences where you need to take people out of the environment and give them something to sort of calm them down. And Nubbin has been an amazing advocate in our community. So I will just wanted to, and she has her own social media, so you can follow Nubbin, K9 Nubbin. Yes. Yeah. But we do have a lot of, we did, thanks to the county, we brought in also a social worker into the police department. This is the first police department here in Fullerton that actually did that, thanks to the help of County Supervisor Doug Chafee's office, who provided this grant for us. We also started the Hope Center, which is Homeless Outreach Proactive Engagement, which is providing first responder therapists and mental health providers and social workers as first responders to anyone with a crisis on the street, because it's an unhoused individual or a call for service. So there are a lot of great things and changes we are doing, because I think this is really the next frontier for us is tackling mental health on all aspects of our lives and how it affects us. So with that, I do want to say stigma isn't just oneself, but it's also how people perceive us. So stigma is two ways. And I think we see that oftentimes with individuals who are unhoused, who are stigmatized in so many ways, but especially if they have mental health issues, that becomes even an additional barrier, because now we are seeing them in a very different way. So we have to also change our perception. We see individuals being arrested and going into court systems and getting stigmatized because they have a mental illness, it is in the record, and suddenly that changes the entire perception of how people see them, how the court systems see them, how educational institutions see them. So I think we need to also make sure that that is something that we are changing in ourselves on how we are looking at other people who may be suffering and struggling with mental health. Those are my final words. I do want to thank our panelists. Oh, would you like to say one? Okay, she's gonna steal our thunder now and take the final word.
I just actually want to plug, because you talked about stigma and reducing stigma, on our table, there is a QR code. It's the Healthy Diverse OC. And what we have there is a large number of events. On a daily basis, there are wonderful events for every one of you to take part in, where you feel completely in a safe space and really feel like you could connect with somebody else and learn something, give something, share something, and at the same time, normalizing those conversations so that we can totally break that barrier of stigma. So I really encourage you to take advantage, because these are taxpayer dollars that are really paying for these events. So we have actually supported that.
Well, thank you for giving a plug to the taxpayer. Round of applause for the taxpayer. And round of applause for our wonderful panelists and for the organizations that they represent. And of course, our keynote speaker, Helen. One more round of applause for her. Thank you for sharing your journey. And for my fellow hosts here, Liana and Debbie, who is filming there, thank you very much. And Villagers of California, thank you very much for being a partner in this, and to all the organizations. Have a great night, everyone.
And thank you for showing up for this. Thank you guys for being here. Thank you. Have a great night, everybody.
All right. Thank you very much.